Welcome to the DMI University Podcast, a series made for successful agents and advisors. Join us as we chat with experts, carrier partners, and special guests about products, sales techniques, marketing, operations, and topics that matter to you. We want to help every agent and advisor grow their business, because when you partner with DMI, your success is our success.
Good afternoon, everyone. I'm Glen, Setchfield, Director of Marketing for DMI. Welcome to our ongoing DMI University webinar series, where we explore agent topics related to sales, marketing, and operations that can all really make a real difference in your business. We are invested in your success, and today we're putting the stethoscope on long-term healthcare cost planning for your clients. Clearly, unforeseen healthcare costs are a big concern for most pre-retirees and retirees. We want to empower you with some easy-to-use tools that'll help start a client LTC conversation, unlock their concerns, and then provide personalized and relevant solutions. So we are joined by our webinar co-sponsor, Nationwide, and their VP from the Nationwide Retirement Institute, Stephen Calandra. Mr. Calandra joined Nationwide in January of 2015 with more than 15 years of financial industry experience. As a vice president for the Nationwide Retirement Institute, Stephen is dedicated to educating financial professionals, clients, plan sponsors, and plan participants about the latest in retirement income planning trends. He focuses on implementing practical and comprehensive retirement income solutions, as well as stimulating the thinking and actions of professionals as they navigate the changing world of investment or world of retirement. My apologies. I'd like to hand things off to Stephen, but first, just want to make everyone aware that for the duration of our webinar, all participant audio will be muted and video will be turned off. I'd like to welcome Stephen. Stephen, it's really an honor to have you here. Thank you so much.
Great to be here, Glenn, and thank you. And hello, DMI team. My favorite way to open up this presentation is with the story of a guy named Tim Bowers, because what this guy did changed the landscape for the conversation that retirees were having with their financial professionals and agents. So check this out. Several years ago in Columbus, Ohio, this guy, Tim Bowers, walks into a local bank, robs it for $80, and immediately surrenders himself to the security guard. When he goes to court, he begs the judge to please send him to jail for 3 years. How old is he, you ask? He's 62 and a half years old. And if we think this through, what is he going to have in 3 short years that he doesn't have between the ages of 62 and 63? Full retirement age for Social Security is 66, and Medicare kicks in at age 65. He explains to the judge that he's been unemployed for almost a year and a half and he's having a hard time making ends meet. And he promises the judge if she sends him to jail for 3 years, that she will never hear from him again when he comes out, because he'll have enough income through his Social Security to live his life, that he'll have enough income, and heaven forbid he continues to get sick, he'll have Medicare and it won't be the end of him. And the judge gives us a gift, ladies and gentlemen. The judge says, Mr. Bowers, this sounds like an awful financial plan. And his reply, it's not the financial plan I had in mind my whole life, but I made too many mistakes, so it's the financial plan I'm left with. So Judge, can you please help me? And the reason why I want to open up today's session with the story of Mr. Bowers is it speaks directly to today's topic, which is preparing for the cost of healthcare in retirement. Now, by way of introduction, my name is Steve Calandra, and I do represent a division of Nationwide Financial. There it goes. That operation is called the Nationwide Retirement Institute. We are tasked with breaking down and simplifying some of the macro issues that retirees face. And we do this by bringing you education and insights, free reports and actionable tools that you can use as a part of your practice's DNA. And then we offer ongoing consultative support. So not only do you have the support of Glen and your DMI team, not only do you have DMI University, but behind them, you also have the back office of the Nationwide Retirement Institute to also help along the way. Please be reminded, as this is being recorded, that this information is not to be taken as investment, legal, or tax advice. This is for educational purposes only. If any questions lean in the direction of taxes or legalities, please make sure to seek the appropriate advice from the appropriate professional. Today's agenda, ladies and gentlemen, what we're going to talk about is going to be threefold. Number one, we're going to talk about the retirement income challenge, or as I like to say, why is this actually an important topic? Number two, we're going to go through the basics of the Medicare system, and we're going to do some flirting with the long-term care conversation. But ultimately, we're going to back into how we can help you create a plan to cover the cost of both healthcare and long-term care in retirement. And ladies and gentlemen, the benefit to being on today's webinar or watching this recording is this. Can we all agree that your clients find the topic of Medicare or even long-term care confusing? If I do my job correctly today, what I want to do is corral your thoughts around how to have the conversation around the basics, and then show you how you can use this information to hopefully parlay into best interest, financial planning, and product recommendations to drive sales. So let's get started with why this is such an important topic, or why we call it a choice of a lifetime. Statistically speaking, when someone in America retires, what do you think their three largest expenses are? According to 2020 studies, number one was always keeping a roof over your head. Yes, even if you pay off the mortgage, there's deferred maintenance. And in most of the country, you're going to have at least 2 to 3, maybe even 4 seasons. Keeping a roof over your head is your largest expense. That's number one. Number two is healthcare. You guessed it. Number three is near and dear to my belly. It's having food each and every day of your life. And don't get me wrong, I love having a home and I love the fact that I'm healthy, but someone please explain to me how having food every day is not number one. Now, here's the thing. What we like to call these expenses are guaranteed essential expenses. And what I mean by that is, can we all agree that whether it's keeping a roof over your head, maintaining your health and having health care, or having food every day, that these are important topics? And are they guaranteed to be important until the day you're no longer with us? You see, that is what we call a guaranteed essential expense. And if we think this through from a financial planning perspective, guaranteed essential expenses should always be covered by what kind of income stream? Guaranteed or non? The reason why I bring this up is because the Nationwide Retirement Institute started to come up with a hypothesis. And that hypothesis was, by golly, there may be a lot of people in the American public that have not accounted for their second largest expense in retirement, which is currently healthcare. So being an institute, we can't do things based on assumptions. So we set out in 2012, and we've done this each and every year, and we do a poll. We only do a small sampling of folks that are getting ready to retire, already in retirement, or have already been in retirement. We partner with the Harris Poll operation you're probably very much familiar with. Now, here's what we do, ladies and gentlemen. We ask this very simple question. How much do you think it costs a 65-year-old married couple to be on original Medicare complete with a Medigap policy? As you can see here, all the way up at the very top, only 1% thought that it might cost as much as $26,000 or more. Drawing your attention all the way down at the bottom, not sure and can't estimate, was 44%. Second most popular answer, 40% thought that a married couple at age 65 to be on original Medicare, complete with a Medigap policy, was going to max out at $5,000. Now, do me a favor, ladies and gentlemen, remember that number of $5,000, because I'm going to come back to that in just a moment, okay? Now, here's the deal. I like numbers because numbers tell stories. Has anyone by any chance figured out what story these numbers tell? 8 out of 10 people that we have interviewed since 2012, right on up to the end of 2019, getting ready for 2020, 8 out of 10 people that we have come across were either drastically underestimating their cost of healthcare and retirement, or they had no idea at all. So, ladies and gentlemen, when we say that this is a retirement challenge or an important topic, it's because we know that it's your client's second largest expense in retirement, and 8 out of 10 people in the American population don't have a number in their financial plan. Now, for the agents and the financial professionals watching this, another thing I like to do with numbers is not just listen to the story, but I like to turn the number upside down. Ladies and gentlemen, if you partner with your DMI University team and you want to go cast a wider net, let's say you want to bring more households into your sales funnel. If you use this topic, you know that 80% of the time, the people that you might engage on the topic of healthcare and retirement are not going to know what their number is, even if they are working with a financial professional. So not only is this an important topic for the public, it's an important topic for your business, because if you were to adopt this and do some marketing around it, this is one of the fastest ways to bring on new clients. So now that we went over why this is such an important topic, now let's go into the basics of the Medicare system. As your clients start to approach age 65, assuming that they want to retire at 65 and neither spouse is going to be working or covered by a previous employer's healthcare plan, a lot going on in that statement, your clients are going to have two options with respect to signing up for Medicare. Option one is what is called Original Medicare, which is the federally administered health insurance platform in America for retirees over the age of 65. It's broken down into different components. Each component covers a different aspect of the insurance, comes with it a budgeting number up front, and has an adjoining risk on the back end to someone's financial situation in retirement. Original Medicare's first component is Part A. Second component is Part B. That is your hospital and your doctor's insurance. But guess what? That doesn't cover everything. So if your clients can afford it and they want to, it's recommended they go out and get a secondary insurance policy, which is also called a medical supplemental policy, or as I like to call it, a Medigap policy. Why? Because it covers the gaps not covered by Part A and Part B. Underneath your Part D, you have to go out and get prescription drug coverage. And when you put it together in a nice, neat grouping, it looks a lot like the type of coverage I have while I work for corporate America. Option one is Original Medicare. Now, some of your clients might want to go with option two, which means they want to go and they want to look at the private sector, because there are private health insurance companies approved by the Medicare system, so they fall underneath what's called Medicare Part C. Underneath Advantage plans, your clients can go get their hospitalization and their doctor's visits covered. They're still going to be able to get their prescription drug coverage. But what you want to understand is this, ladies and gentlemen. Fidelity came out with a study in 2016, so it's slightly dated, but it still holds true. And that suggests that by the time someone is 5 years in retirement, they're on Original Medicare, whether they tested a Medicare Advantage policy or not. So since I know that about 73.27% of the American population are all going to be on Original Medicare within 5 years of retiring, we're going to focus our comments on Original Medicare, because that's going to help you serve the greatest number of people that you come across. The first component of Original Medicare is what is called Part A, which covers your hospital insurance. This is when someone has an inpatient hospital stay for at least 3 nights or more. When someone comes out of a qualifying Medicare Part A stay, their path to recovery is also covered. Potentially skilled nursing facilities, in-home health care, but that's only for a finite period of time of less than 100 days. And you have to be on the path to progress, getting better and recovering every day. What you want to understand from a financial planning perspective is Part A, for the majority of Americans, and I'm talking 99.9% of the American population, has prepaid their Part A hospital insurance while they were working their careers, or they had a spouse that was working a career. In other words, a portion of your FICA taxes goes to prepay your Part A hospital insurance. Now, this is important. You want to understand that on the back end, there is high deductibles for Part A and potentially high daily copays. Heaven forbid someone pulls the short straw and has to use their Part A hospital insurance, especially if they have to stay in past 60 days. Part A is your hospital insurance. There is no monthly budget to worry about for the majority of Americans that you'll be working with. However, on the back end, there is a major risk to someone's financial situation that comes in the form of high deductibles and high daily copays. And if someone doesn't have a proper Medicare plan, they might have to accidentally draw down on their retirement savings because they didn't have a proper plan to cover their health care in retirement. Part A is your hospital insurance. That means that Part B is your doctor's insurance or your medical insurance. This is when you need to go get a physical. This is when you walk outside and you slip on the ice and you hurt your ankle. If you get an emergency ride in an ambulance to the hospital, that falls underneath Part B. Let's say you need crutches or you need a boot. Durable medical equipment is usually covered underneath Part B. Outpatient services. Recently, my father had a bout of cancer. He beat it. Thank you very much for applauding. But you know what? For over a year, he had to go for continuous chemotherapy. Now, he was not fully admitted into the hospital. So is that Part A or Part B? That's Part B because that's an outpatient service. From a financial planning perspective, there is a monthly premium that's based on someone's modified adjusted gross income. That is a creative way of saying it's means tested. So there will be some people in your book of business that are actually paying a higher premium for the same services that someone might be paying less. There is a $203 deductible in 2021. And there is a risk on the back end to someone's financial situation because Medicare Part B only covers 80% of the medical or doctor's cost. And if you don't have a proper Medicare plan, you might be on the hook for that 20%. Now, looking at my father, if my father did not have a proper Medicare plan and he went on chemotherapy for upwards of a year. Now, I don't know what chemotherapy costs, but can we imagine that it might cost upwards of $50,000 a month? If my father was on the hook for 20% of $50,000 a month, that would have meant that he would have lost about $10,000 a month or $120,000 a year from his retirement nest egg. That 20% is very important, and that's why it might behoove you to make sure that your clients always have a proper Medicare plan in place. Many people like to ask, what are the brackets for Part B premiums? And as you take a look here, the best case scenario for a married filing jointly couple is if they are earning $176,000 or less, or an individual tax filer making $88,000 or less in retirement, they will pay $148.50 per month, and that'll be per spouse if it's a couple. You will notice that very quickly, if one goes above those thresholds, they start to bleed in to these higher brackets. And this is the means testing, or the IRMA, earnings adjusted price for your Medicare Part B. Medicare Part D is your prescription drug coverage, ladies and gentlemen. Averages out right around $50 per month per spouse. The thing you want to understand from a financial planning perspective about Medicare Part D is that they only cover 75% of the prescription drug costs once someone has exhausted a very small, usually several $100 deductible. And that means that you'll be on the hook, or your clients will be on the hook, for a 25% coinsurance, and there's no way that we can help your clients plan away from that risk. That brings us to what I believe is the most important aspect of today's presentation. So if you don't remember anything else we talk about today, please remember the voiceover of this slide. If you want your client base to have a proper Medicare plan and they go with original Medicare, you would want to advise them to look into a Medigap policy. Remember on Part A, there were high deductibles and high daily copays? And remember underneath Part B, there was the 20% coinsurance? If you want your clients to mitigate or almost eliminate that risk to their financial situation in retirement, on average for about $200 a month per spouse, they could transfer that risk to a Medigap policy instead of shouldering it themselves. This is where you can help the greatest number of people in your book of business by making sure that they have a proper Medicare plan if they choose to go with Medicare, original Medicare, and they can afford a Medigap policy. So now what we can do, ladies and gentlemen, is we can start to put together a budget. Do me a favor and in your mind's eye, answer this question. Medicare Part A covers your what? Hospital insurance. There's no monthly or annual premium to be aware of for the majority of people that will be in your book of business. But Part A comes with high deductibles and high daily copays. Medicare Part B covers your doctor's insurance. Averages out, best case scenario is $148.50 per spouse per month. 20% coinsurance on the back end. Medicare Part D covers your prescription drug coverage, averages out just under $50 across the whole United States. 25% coinsurance, no way we can help your clients protect themselves from that. Most importantly, what does a Medigap policy do? It plugs the gaps not covered by Part A and Part B, the high deductibles, daily copays, and coinsurance of Part A and Part B only, right? That means, ladies and gentlemen, for a married couple at age 65 to be card-carrying members of Original Medicare complete with a Medigap policy, it will cost them a minimum of $9,802 and change. Anybody happen to remember the number I asked you to remember on the survey slide? 40%, second most popular answer, thought that the answer was going to max out at $5,000. For the mathematicians on the webinar today, if we compare $5,000 to $9,800, what percentage mistake were they making in their second largest expense in retirement? That's darn near a doubling, isn't it? Almost 100% mistake. And for the people that had no idea what their cost of healthcare was going to be in retirement, they were making a much, much larger mistake, and they're going to have some difficult conversations down the road potentially. And oh, by the way, we haven't even talked about using the insurance yet, have we? These are just the premiums. You see, ladies and gentlemen, our goal in doing this presentation was to set up why this is an important topic. Second largest expense, 8 out of 10 people in the American public have the wrong information or no information in their plans. That equals a fantastic opportunity. Then we wanted to make sure that we educated you on the basics of Medicare. Now what we want to do is show you how we can help you create a plan using the Medicare conversation to then back into very gently the long-term care conversation. Nationwide has gone out and partnered with an actuarial firm called Milliman and Associates, several other strategic partners, and they have helped us create a personalized healthcare and long-term care cost assessment. We can make this available for you to use at no cost. All you want to do is get with Glen and his team and get a copy of the healthcare cost assessment fact finder. Once you get a hold of that fact finder, whenever you want to get one of these complimentary reports for someone in your target audience, you help them fill out that fact finder, submit it to the back office of the Nationwide Retirement Institute, and within 3 to 5 days, we'll give you back this report that I'm going to walk you through right now. As you can see on the cover, that we can actually personalize this. We can put your name on it. We can put your client's name on it. And in addition to that, we can add DMI's branding underneath that information. We're going to cover some of the questions that were asked in the actuarial profile that was built from the fact finder. So if you ever sit down with a client to use this as a prop to make a product recommendation, you can review to make sure the information is correct. Next, what we're going to do is we're going to show you, for those of you that write annuities, we're going to show you what someone's average 5 years are going to cost. Because if you do buckets of money strategies in retirement, and then you position certain products to cover certain buckets of money, in that case, we give this to you as an income need. So then you can figure out how you can get a guaranteed benefit base, spending enough income to your clients to cover this guaranteed essential expense. Further, we're going to go to page 5 of the report, and we're going to show you exactly what makes up those numbers. Working from left to right, we're going to show you the year and the age your client told us they were going to turn age, 65, or that they want to go on full-blown Medicare. In this example, it was 65. We're going to put in Part B premiums, Part D premiums, and supplemental premiums, and we're going to extrapolate it out for inflation. We're going to put in additional out-of-pocket costs, and then we're going to total it up for each spouse. Now, if you look all the way over to the right-hand side, you're going to see that we're going to give you a household total, and that household total is an actuarial profile total. This is not a best-case scenario like we just saw on the other slide. It's not even an average number. This is a number that is based on your client's actuarial health profile. The other thing we're going to do is we're going to back out Part B premiums for you. Because if someone ever signs up for Social Security before they sign up for Medicare, guess how they pay their Part B premiums? It happens to come right out of their Social Security check. What do you need to know when you're trying to determine an income need to build in a product recommendation is, are they going to pay for their Part B premiums out of their checking account, or is it coming out of their Social Security? If you would like to, you could also use the average number all the way down at the bottom to uncover the income need. Let's say you happen to go out, you do a seminar, you have a client that could benefit from this report. You decide you want to do the report form, you have them to fill out the fact finder. When you sit down, you realize they're about 55, 56 years old. They got a long time before they're signing up for Medicare. Does that mean this report doesn't help? Nope, it sure does. Because now what we can do is we can take the average number down at the bottom, and let's say that they were with a competitor and they had a written financial plan. Because you went through this training, you know the first thing you should always look for is, do they have a number in there for their cost of healthcare? If that number is less than this average number right here, or if they have no number at all, you should have a sale. Because then what you do is you position this with the client. You say, Mr. or Mrs. Client, the reason why I do this is because I look at healthcare as what I call a guaranteed essential expense. And what I mean by that is, can you agree that your health and having healthcare is important to you? Duh, silly question. And is it guaranteed to be important to you until the day you're no longer with us? They're going to say yes to that. And you say, well, that's what I call a guaranteed essential expense. So if I'm going to work with you just to solve for this inefficiency in your financial plan, and I just carve off a small piece of your portfolio to cover this guaranteed essential expense, how much of that income would you like to have guaranteed, if any of it at all? And let that answer be your North Star as to what kind of recommendations you make. Now, in addition to having your client's actuarial health profile, the next thing we can do is, once you walk them through the Medicare conversation, well, then you turn over to the next page and, well, you know what? I just so happen to throw in for you a long-term care cost assessment as well, Mr. and Mrs. Prospect. In this report, because it's based on your client's actuarial health profile, we can show you at what age and in what year they are most likely to have a health event that equals a catalyst that will increase their health care in a long-term care conversation type of manner. Furthermore, we can break down what temporary assisted living might be, what full-blown nursing home might be, and most importantly, what in-home health care might be. Now, we can do this for both spouses, not just one spouse. And then we can also do a similar buckets of money strategy if that's the way you like to position your products. The way you get this, ladies and gentlemen, is through a one-page client questionnaire that you can get through your DMI University team. Go right to Glen and his team. They all have this, and they're going to follow up with you, and they're going to make sure that you have a copy of this in your inbox. All you're going to want to do is you're going to want to make sure that your information is at the very top. You'll see here that you can check the IMO box when you're working with DMI. You could put in your first name and your last name because you're the requester. You put DMI in underneath the IMO section. You put in your phone number, your email, and your address. Now you help the clients fill this out. They're going to put in their first name, their last name, what age they plan on retiring, where they plan on retiring in the country. If you want to see a comparison, you could put 4 different locations. We'll give you 4 different reports so you can compare and contrast. We're going to get an actuarial health profile on your client by having them just check some yes or no boxes. There's no HIPAA risk here. This will never end up on a medical report, and this will never end up on the insurance side of the house. We're going to ask how much income they're going to be making in retirement, because that's going to dictate what their Part B premiums are going to be. And then we're going to ask you, how much of Medicare do you want to see in the report? In addition to that, if you check the box that says both, we're going to give you both the Medicare as well as the long-term care cost assessment all in one report. Now, ladies and gentlemen, my goal in doing this presentation today was threefold, right? Why is it an important topic? Teach you the basics, offer you a tool that you could use to back into product recommendations and drive revenue. You also might remember that story of my friend, Mr. Bowers. And if you want to know if that was a true story, do me a favor. And after you go through this training, do a Google search for the name Tim Bowers, Bowers. Put in the 2 words bank robber after his name. And you can read all the articles that were written about him when he came out of jail 3 years later, because it was a true story. Now, I think we can all agree that that's a very bad plan B. And I don't want to see that for anyone that you work with. So if this presentation has been helpful for you, please consider using this complimentary report to help drive sales and make sure you leverage your DMI team. With that said, I'd like to turn it back over to Glenn, and thank you for inviting me out.
Thank you so much, Stephen. And yeah, that Bowers Plan B is a no-go. Bad deal. We don't want that. So, hey, Stephen, I love how you break that topic down. Thank you so much. Great presentation. And this does represent the conclusion of our webinar, but please don't miss out on the resources from this webinar and other resources on dmiuniversity.com. And for qualifying agents, if you're engaged with us at a certain level, we can actually help you build a campaign and a webinar of your own, where we will help you actually get people to that webinar. But give us a call. You can call us about anything related to sales, products that'll be a good fit for you, operations, and marketing as well. Call us at 800-322-6342. But thank you very much. Have a very nice day.
Thanks for listening to the DMI University podcast. For more information about today's episode, resources, or to learn how you can partner with DMI, visit us at dmiuniversity.com. Stay tuned for our next episode.